love to talk a little bit more about what you can do to advocate for continued progress. And so one of the things I'll kind of start off with is like a little bit of bad news. So I think, at the beginning of the webinar, Nicole had mentioned that Laura and I used to work for what was called the NIH Office of Pain Policy and Planning. You might have heard in the news that there were sort of throughout the government something called a reduction in force, which is basically a technical way of saying layoffs. And what happened during these reductions in force is whole offices were just sort of closed based on their name. And so our office had policy in the name, and so our office closed. What we did in our office was we had staff members who were really, people who are passionate about pain research and clinical care. So 14 staff members, we helped to manage and coordinate all of the pain research programs going on both within NIH, but then also across those federal government agencies. So this goes back to the Affordable Care Act, where one of the laws that Laura had talked about earlier was coordinating all of those different federal agencies that are funding pain research or involved in coming up with pain care policies. Our office used to coordinate those efforts. So that, with the closing of our office, we're not really sure what that means in terms of the future and how that's going to be addressed. What we also did was we organized pain research programs that are required by Congress, like the NIH HEAL initiative. And we helped to make sure that, anytime someone was reaching out to Congress and that congressperson reached out to NIH to ask about pain research, that we were getting them the answers that they needed to be able to go back to the people who reached out to them to begin with. And then finally, where we were really sort of working on and building towards were efforts to engage people with lived experience of pain in pain research and working on education campaigns for the pain community. Because what we realized was there was a lot of pain research happening, but then it wasn't getting out to people living with pain or people with lived experience of pain. And so we saw that as like a really important gap that we wanted to work to move toward addressing. The other thing that's a little bit in question in terms of the future of pain research is funding. So in recent talks, so kind of, I would say over the summer, the president had proposed major budget cuts to NIH. And what he had included in that, the way if he was wanting to restructure NIH would mean large cuts to pain research and also to the HEAL initiative. But because of advocacy efforts, so people like Chris and also Nicole and Kate Nicholson from the National Pain Advocacy Center, Congress became aware of how important pain research and HEAL funding was. And it doesn't seem like from, at least how the conversations have been going in different hearings and things like that, that they think funding should be cut in those areas. So in terms of what the future of pain research funding holds, right now, you might have heard, the government shutdown. So this was all centered around budget talks, or at least partially around budget talks. And right now we're on what's called a continuing resolution. And so that just means they decided that we're going to have the same budget right now as the previous year until we get to about January, where they'll have to make another decision of what the budget is going to look like. And so advocacy in this area is still important for getting the word out to, Congress people that pain research funding is important. So things you can do. We wanted to kind of close this webinar out with some action items in case you're feeling inspired and really, really jazzed about pain research. So Chris is going to talk a little bit more about how you can contact your Congress people and then also learning more about how to become a pain research partner.
Thanks, Janelle. So many of the things that we talked about today on this webinar have resulted from advocacy for pain research. So for example, the HEAL initiative that really increased the overall budget for pain research at the NIH started with advocacy. And with us going and talking with people at Capitol Hill and members of Congress. So I really want to encourage you to consider participating if you can. And there are three main ways that you can reach out to your congressperson. You can call the office. You can send a letter or an email, or you can do an in-person meeting if you're going to be in Washington, D.C., or a virtual meeting. Next slide. Thanks. So this has been highlighted a little bit across the webinar, but this summer, our organization, the CPRA, partnered with US Pain, the National Pain Advocacy Center, and the US Association for the Study of Pain to advocate around all of the changes that were being proposed to research funding in general and pain research in specific. And so we developed a whole host of materials, a one-pager, a slide set, talking points. We did webinars and trainings to prepare people who have maybe never participated in advocacy campaigns this way, all of which you can find on the link that's on the website. This is still ongoing. Right now, we're kind of in a holding pattern, just waiting to see kind of what happens next at the NIH and with the budget, but we were able to meet with over 20 members of Congress this summer, and each of the virtual meetings actually, it was a group partnership. So we had a person with lived experience of pain, a policy expert, so one of us from an advocacy organization, and a pain researcher from the U.S. Association of the Study of Pain, that all met together virtually with these members of Congress. So it was really quite well received and went very well. And as Janelle said, our message really resonated. And actually, many of the people that we spoke with in these offices had their own lived experience, family members who had chronic pain or themselves who were dealing with pain. So they really understood how important it is and how important it is that we don't go backwards, right? We still are not receiving the level of pain research funding that we need. And so we really can't afford to go backwards. We need to go forward. Next slide. So if you're interested in being, in learning more about advocacy or potentially volunteering, you can visit US Pain's website, the link on the bottom. They have an advocacy link where you can learn about priorities for US Pain. You can learn about current action campaigns that you can take part of. And you can also register if you want to be alerted for additional advocacy opportunities in the future. And if you're interested, I just fielded a question in the Q&A about how to become involved in research. So if you're interested in becoming a partner or partnering with a pain researcher, there's a platform that's being worked on right now. It's not live yet. So we envision this kind of the central platform where people who have lived experience and researchers and community organizations can all go and kind of find one another to be able to partner. Right now, that doesn't exist, but we're building it. And so if you're interested in the future to learn about these opportunities or kind of sign up or connect with a researcher, if you're interested in working with them to plan, design, or conduct a research study, you can visit the US Pain website through the QR code that's on the screen and enter your information.